Welcome, ladies and gentlemen. Welcome all to the Get in Position Foundation. I am your kidney health coach, Craig, and this presentation is sponsored by the American Kidney Fund, which I am a certified kidney health coach through that organization. Welcome to our live education session today. And today we're going to learn about what chronic kidney disease is. I am also the founder and executive director of the Kidney. I apologize. That's the Kidney Corner podcast. I'm the host there, but I'm also the founder and executive director of the Get in Position Foundation. And we're doing a lot of great work there, helping kidney patients with some counseling, some personalized support, and mentorship as well. So this month is National Kidney Month. Some people call it National Kidney Health Awareness Month, the month of March. So all this month, you'll be seeing things from us, the Kidney Corner podcast. We have a series going on there entitled I'm So Sorry to Hear That. These are amazing stories from our mentees, actually, kidney kidney disease patients telling their stories and their experiences on dialysis. So you want to check that out. Share the link and also share this link, this live link, to anyone you may know who is dealing with kidney disease, who just found out, who may have been diagnosed, and they're trying to figure out what to do. This is also preventative care as well. So we want to keep everyone healthy. We're trying to slow the progression down of this disease. It's a dreadful disease. And I dealt with chronic kidney disease for over 23 years. And I was recently transplanted in 2023. And we'll get into some of those things as well. So, again, this is interactive. You can ask questions, make comments as we go along. If something catches your eye, write it down and just proceed to ask your questions. So, I am, we're just about ready to get started with our education session right now. As you can see below, the ticker tape is scrolling at the bottom of your screen. Our contact information. We have a new email address. It's info at getinposition21.org. That's info at getinposition21.org. If you got questions or you're trying to get in touch with us, you can do so and connect with us there. Also, subscribe to our YouTube channel at our website, www.getinposition21.org. And you can scroll down to the bottom and see how to subscribe to that YouTube channel. So let's go ahead and let's get into some things. Chronic kidney disease, or CKD. Let's get into this. What is chronic kidney disease? So, chronic kidney disease, or as it's known in the industry as CKD, is permanent damage to your kidneys. And that is correct. It is permanent. There is no fixing it. There is no repairing it. It's permanent. The damage will not go away, and it can get worse over time. Now, there's mild damage, and we'll see some slides about that. You may be able to prevent CKD or slow the damage down. I just mentioned that, so you'll be able to slow that damage down. We'll get into that in a minute. I want to ask a question. to those who may be watching and viewing this live broadcast, um, how many adults in the US have CKD? What is your guess? Is it 5%? Is it 15%? B, 15%? Is it C, 50% adults in the US have CKD? Or is it D, 75%? Which one is it? What is your guess? What is your guess? If you're out there, this is interactive, so you could you can leave a comment, you can answer this question, or even ask a question. So let's go ahead and give the answer. The question is, how many adults in the U.S. Have CKD, chronic kidney disease? The answer to that is B, 15%. 15% of Americans have CKD. It's 1 in 7 adults. 1 in 7 adults uh, in the United States that have or suffer with CKD. Now, I'll go even a step further because if we break that down into demographics, 1 in 3 African Americans, 1 in 3 African Americans suffer from CKD. I'll just put that out there to the audience. So you got these three here. There's one, if you're talking about African Americans, one, and then another one. Okay, put that in perspective for you. All right. So that's my goal is to educate my community, and that's the Black and brown community, not discounting any other community, but and you'll see why. You'll see why as we go along. That's so important to me, and it should be important to those communities as well. So it's 15%. All right, there are 5 stages of chronic kidney disease, CKD. 5 stages. As you can see here on this diagram, you see how it's broken down, and it tells us how much damage. So stage 1, mild damage to your kidneys, a slight loss in function, not that much, and it's not noticeable. Stage 2, still mild, not noticeable as much. Now, when I was diagnosed with CKD, I came in on a stage 3, and that was what, 2000. And back then they didn't break it down to stage 3A and B. It was just stage 3. So you have mild to moderate, medium loss of function, stage 3B. It's moderate to severe. Okay. Medium to severe loss of function. Now there are signs. You still don't quite feel anything. You don't feel anything, pain or anything like that. But there are some signs. They do call this the silent killer, but I'm learning how to change that verbiage. It's not so silent if we're paying attention. It's whispering. I would say it's whispering. So it's not as silent because there's some symptoms there. We'll get into that in a minute. Stage 4 is very severe damage. Remember, it's permanent damage to your kidneys, severe loss of function. And stage 5 is most severe, and that is considered kidney failure. Okay. Near total or total loss of function in your kidneys. Kidney failure. Let's talk about that. Kidney failure. It's also known as end stage renal disease, ESRD, or end stage kidney disease, ESKD. Kidneys, they stop working, but they have some function to keep you alive, right? some function to keep you alive. You will need, at the stage of kidney failure, you will need dialysis or a kidney transplant to stay alive and live a good quality life. So you see here in this illustration, it is, well, a picture. It's a dialysis machine. And what's up with my mouse? Okay, there we go. We got it. All right, symptoms of CKD. How do we know? How can we tell? CKD, it gets worse slowly over time. So there's a slow progression of CKD. Most people have no symptoms, right? In the early stages, from 1 to 3, there are no symptoms. But there are some signs, some slightly, like I said, the industry calls it, or we may know it as the silent killer. Silent means nothing, you hear nothing. But I'm learning to say something a little different or rephrase it as it's whispering. Okay. And we got to listen very carefully because of that whisper, right? You may not have symptoms until your kidneys are badly damaged, like in stage 4 or 5. Usually, when individuals are diagnosed, they don't find out about it until the last minute, right? Having to go to the doctor, some things have been happening to your body. You notice now you got to go to the doctor, or it's in the emergency room. Something drastic has happened. You're in the emergency room now, and then they tell you, "Oh, you have CKD." Right? We don't want to find out that. We definitely don't want to. Okay, we'll get into it. We'll get into it. The only way to know if you have CKD is to get tested. Early prevention, right? We have to take early preventions and get tested. So now we really have to think about our kidneys because they're very vital. They're very vital. You feel fine. That's all I hear. I said that when I was diagnosed. So, but now we have to, when you do your yearly checkups now, you need to include a kidney test. I'm serious. You need to include a kidney test. So, let's see. I don't know if you guys can really see that because I'm in it. I'm in that. Let me pull up for just a second. Uh, so here are some symptoms of advanced kidney disease. Advanced kidney disease, dry, itchy skin, muscle cramps. And when we talk about the cramp, I mean, they happen in often than usual. Feeling sick to your stomach where there is vomiting, constant vomiting. That should raise a red flag, ladies and gentlemen. That should raise a red flag for us. Not feeling hungry. You lost your appetite. All of a sudden, you just lost your appetite. You're not hungry as usual. Do not ignore these signs. Pay attention. Like, why is this? Okay. Swelling in your feet and ankles. Now, last Tuesday, we learned what do the kidneys actually do. They help filter the blood. Of course, they do some other things by producing some hormones, but they get rid of waste. They get rid of fluid, right? They regulate the fluid balance. Now, if you're retaining fluid, and usually it's in your legs, it's in your ankles, it's in your feet, please pay close attention to that. Yes, pay attention to your diet, what you're eating, but take notice of it. Do not ignore it, people. Decrease urination. If you're not going to the restroom, if you're not urinating often as you should, that's a sign. That's a sign. Trouble catching your breath. All of a sudden, I can't have trouble breathing. Wow, what's going on with that? Trouble sleeping. Trouble sleeping. Please do not ignore these signs, ladies and gentlemen. They're telling us, all right? Okay, these are the whispers that I was speaking about. It's not so silent at this time. So, all right, other health problems may be a sign that you have CKD. Anemia, not enough red blood cells in your body, which can make you feel tired. Again, last Tuesday, we learned that the kidneys produce a hormone that produce red blood cells. So now you got kidney damage, and so not enough red blood cells, so you're cold, right? So that's the anemia. Gout. Listen, I do not wish this on my worst enemy. Did I experience this? Yes, I did. Yes, I did. Not good. Really not good. The worst. High potassium hyperkalemia. Hyperkalemia. Now, that means it's too much potassium in your blood. And what does hyperkalemia mean? What does that mean? And what are the symptoms of it? You may have heart palpitations, shortness of breath, chest pain, nausea, or vomiting. That's the gist of it. So if those things are happening, folks, please do not ignore those signs. Okay. If you find out you have CKD early, you may be able to stop the kidney damage from getting worse. You can slow it down. You'll be able to slow it down, the progression of it. Just slow that down, right? Uh, it's permanent. We said that in the beginning. It's important to get tested to find out that you have CKD early, such as in stage 1 through 3, especially if you have high blood pressure or diabetes. Those are risk factors. We call those risk factors. And just a disclaimer, I'm a kidney health coach. I am not a healthcare professional, just as a disclaimer, but I am a experienced professional. I'm a experienced professional dealing with CKD. You may take steps to stop kidney damage from getting worse and keep your kidneys healthy as long as possible if you get tested. Who can get CKD? Let's pay attention to this slide, folks. Anyone can get it, right? We said 1 in 7 and then 1 in 3 African Americans. You may be more likely at risk to get if you let's look at these things. You're most likely to get or at risk of CKD. These things here. Let's see. Let's see. Let's talk about it. If you have diabetes, you're more likely at risk to get CKD. High blood pressure. Pay attention to these slides, right? In the order. In the order, right? Have heart disease. You're more likely to be at risk of CKD. Have a family member with kidney disease. That's why when you go to the doctor and they ask you to fill out all this information and they talk about your family history. So it is very important for everyone to know their family history. Ask questions to your family. Anybody in the family suffered with this or had this or that or whatever, heart disease, high blood pressure, if it runs in your family, it's very, very important that you know your family history. Okay. Now, this slide here, well, this risk. Look at the number one. The number one reason, if you are black, think about that, folks. If you are black, you're more like the studies is showing, or the industry is saying, if you're black, you're more likely to have CKD. We need to pay attention to that, right? In the black and brown communities, Hispanic, Native American, or Asian Pacific. Pay attention to that, folks. Now, my thing is this. All of that could change if we change some cultural things, right? That's my personal opinion. It doesn't have to be that way. But right now, the studies is showing this, right? It's all what you're eating. It's our eating habits. It's our discipline with eating. Um, I had a gentleman who used to sit next to me in dialysis, and I mean, he's so close, you can't help but to hear the conversations. Not that you're trying to be nosy, but you hear the doctors talking to him, and they saying the same thing over and over and over again. When they make their rounds, he's coming in with stuff from the gas station, snacks, and all this other stuff. So I tried to talk to him because I'm like, "Yo, man, we're in here together. You know, I care about you. Why is it? Why you can't correct it?" I asked him that question. And you know what he told me? He said, "Man, I've been eating like this all my life. I can't help it. I've been eating like this all my life." Now, that may be true, but okay, are you going to do something about it? See, that's the thing, folks. I'm off my soapbox. I digress. I'm that type of coach. I'm that type of coach, yo. I'm trying to get it. It's all mental. But the last one is over the age of 60 years old. You're more likely. That's what it says. You're more likely at risk to get CKD. Now we got another question. Our next question is the number one cause of CKD. All right, think about this, folks. A, your age. Is it your age? Is it B, alcohol? Is it C, diabetes? Or is it D, high blood pressure? Think about the answer. What is the number one cause of CKD? This interactive, folks. You can ask, you can answer, leave us a comment or whatever. What do you think the answer is? I'll give you a minute or a second, a few seconds. What is the number one cause of CKD? All right. What is it? What is it? What is it? Anyone? All right, here we go. Number one cause is C, diabetes. That's the number one cause of CKD. Now, if you go back to two slides, it says more likely at risk. Black. It said black. If you're black, if you're Hispanic, Native American, Indian. So we gotta control what we're eating, how we're eating, our diet. Now, granted, there are some individuals, and I'm talking about type 2 diabetes. Now, there are some individuals who are born with type 1, right? That's something that they just couldn't help. They just couldn't help that, right? However, we have to get discipline again. It goes to our diet, what we're eating, um, those types of things, taking our medications on time, exercising. Now, for me, I hate working out. I can't stand it, but I have to do it. I have to do it. Being a kidney transplant recipient, I have to do it. I got to stay fit because I want to keep that organ healthy. I want to be healthy now. Okay, so that's the number one cause, folks. Diabetes. 50% have diabetes, and you're more likely at risk of having CKD. Diabetes is a disease in which you have too much sugar, glucose. We know what that is. We know what that is. But here's the thing. This is something that we probably did not know. Over time, high blood sugar can damage small blood vessels in your kidneys. and cause CKD. That's the thing. That's the issue. That part, right? That part. Um, as far as it relates to diabetes and being at risk with CKD. All right. So here's question number 2. What is the second that or the number 2 cause of CKD? Diabetes is 1. What's number 2? We got the same selections here. What do you think it is? A is age, B is alcohol, C is diabetes, D is high blood pressure. What you all think it is? What do you all think it is? I'll give you a second to answer that. All right. Y'all ready for the answer? Here we go. D, high blood pressure. 25% of the population has high blood pressure. Okay? That's the number 2. High blood pressure means your heart is working too hard to pump your blood. It's working too hard to pump the blood. Because the blood flows through your arteries, veins, and blood vessels with too much force or pressure. This too can damage blood vessels in your kidneys and cause CKD. And then if you have CKD, it could cause high blood. It's like it can't win for losing, right? It's a tug of war. So we have to get our blood pressure under control, watch our diet, move. If you're not a big workout fan, I get it. I get that part, but we got to move. We got to lose that weight. We have to watch what we put in our bodies. Definitely have to watch. We have too much information not to know these things now, right? Google, all this other stuff. Got to find a credible source, but you know, and even talk to your doctors if you need a nutritionist. Talk to them. Okay? So, tests for kidney disease. We said earlier that you need to get tested. And I go even a step further as to say when you're doing your yearly checkup, for women when you're getting screenings, and for men, for women when you're getting screening for breast cancer, your mammograms, pap smears, those types of things, add a kidney disease test to that. Men, um getting prostate checked, your colon checked, all of those things, your yearly physicals, add this to that list. Add it to that list. Kidney disease tests, right? The only way to know that you have it, and we're not saying you want to know that you have it, you just want to stay away from it, try to prevent it, right? Is to get tested. There's a urine test. It checks for your protein levels in the urine. Why is that important? Because your kidneys should not be spilling or releasing protein. Your body needs protein for energy and muscle, even muscle mass, to give you that energy. But your kidneys, as your blood is being filtered, your kidneys should not be releasing any protein. That should be going back and flowing back into your bloodstream, your blood system. It helps detect damage to your kidneys if there's damage. Some people may have damage, mild damage. Um, we take bumps and bruises. We fall. Some people develop damage to their kidneys because of a fall, right? Um, those types of things. And we need to be tested. Having protein in your urine for 3 months or more can mean you have CKD. So this test should be added to your physical and testing regimen. This test for kidney disease, urine tests, right? The albumin to creatinine ratio, UACR. It uses a microscope to look at urine in the lab. You 9 times out of 10 to test this. Sometimes when you do your blood work, they'll say, okay, here's a cup, and boom, come out, leave it here. That's what they do. Albumin. Albumin. I believe that's how you pronounce it. It's a type of protein. Creatinine, it's a waste product in the blood. That's what they test for. And you see here the chart below. The normal, high, very high. And also it's good to go over your lab results with your doctor. That's always good to go over your lab results with your doctor. Have them explain it. If you don't know what that is, what is that? What does this mean? What does this terminology mean? What is this? Why do you look at this? What are the critical things that you look at, doc? Why is it important? Ask those questions. You have the right to. You have the right to. You don't understand something, ask the question. The blood test, the EGFR, the estimated glomerular filtration rate. We'll just say EGFR. It's a calculation, folks. And it's done through the blood. It's a blood test. It tells how well your kidneys are working. The doctor will look at your EGFR over 3 months to decide if you have kidney disease. The numbers, now there was an issue with this calculation, this particular test. Prior to 2023, when the policy changed, the whole calculation of the EGFR changed. It was actually a racially biased test because when I was diagnosed, there were two tests, and let me break this down because it happened. It really happened. It happened for me. What the test said? It said EGFR. It had a line item EGFR. Then it gave a number. Then below that, it said EGFR if African American. See how racially biased that was? And it was miscalculating, stating that if you're African American, it was actually stating that our kidneys were functioning better than any other ethnic group out there. Actually, our kidneys, it was the same as any other ethnic group. So what did that mean? What happened? It meant that, okay, if the doctor saw that and you are African American, oh, your kidneys are doing what you don't need dialysis. You don't need a transplant. You're okay. So guess what happened, folks? And this is just the honest to God truth. Many of our family members could have been on dialysis a lot sooner, could have received a kidney transplant a lot sooner. Many of our kinfolk passed away because of this racially biased test. The policy changed January, it was either the 3rd or the 4th, 2023, where all transplant facilities were mandated. They were mandated to go back in and adjust or recalculate everyone's time who was on the wait list, especially if you were African American, if you were Black. Every transplant facility across the country was mandated to go back in, readjust their time. And so if you was down here on the list, then your time was readjusted to actually being doubled. So I was on the transplant list for 4 years. 4 years. My time was readjusted to 8. It doubled. I received a call on a Friday stating that one of my transplant facilities went in and readjusted my time. On a Friday, they called me. Friday evening, they called me and said, "Hey, we readjusted your time. We were mandated because of the new calculation, the new policy." On a Friday. On Sunday, I got the call for a kidney transplant. So I hope that puts things in perspective for everyone to see um, what this racially biased test then was actually doing and how quickly it changed the game. It changed things. So my job as a kidney health coach, and especially from our foundation, a Get in Position Foundation, hey, I'm trying to help folks get in position. Okay, because there's some things that's racially against us, and it's just the truth. It's just the truth. Call it what you want. Woke, I am. I'm awake, wide awake. Okay, so hey, get tested. Know your numbers. Know where you are. Um, don't let it fall by the wayside. Your health is indeed your wealth. So I'm off my soapbox, folks. I digress. Here we go. Back to this. Back to this. So through the EGFR results and stages of CKD, that's how they can tell. And here are the numbers: stage 1, 90 or more. You got normal function. Stage 2, you guys can see it, 60 to 89. Yeah. So your EGFR should be greater than 59. That's what the test will tell you. It should be greater than 59. If you're falling below 59 and you're into the 40s to 45, you have mild and moderate damage to your kidneys, you're in stage 3. Anything below that, less than 15, kidney failure, permanent damage, folks. So it's important to get this test done. Keep track of your numbers. I said that earlier. Ask your doctor about these tests. I said that earlier. And your results. And also ask how often should each of these tests be done and performed. Listen, your life is worth more. I understand the test may be expensive. So what? So what? That's a small thing. That's a small thing for me to know. We got to renew our minds as it relates to our health. So if you have insurance, thank God you got it. Use it. Don't let the year go by or even 6 months go by. Here we saying 3 months. Don't let 3 months go by and you haven't, scheduled your appointment for any of these things. Blood sugar levels, A1C, your blood pressure. You should have a blood pressure machine at home. Everyone should, just to take it, just to see what's going on. And again, folks, I will reiterate, please add kidney tests to your yearly follow-ups and stuff like that. Add it to the list. All right. So what's the next steps you will take? What are the next steps you should take? You should ask your doctor to test my blood sugar levels for diabetes. Check my blood pressure. Please check your blood pressure. Ask your doctor to test for kidney disease. No, we don't want you to have it. No, no, no. But again, remember, the industry says it's the silent killer. I say it's whispering. It's not so silent because it sets off other things. So please make it an appointment to ask your doctor to test your kidneys. As you age, because one of the risk factors is if you're over 60, you're likely, they said you're likely at risk. So we're getting older. And I even listen, the young people now, because the food, everything we eating, the things that we're taking in, and this is just something I want to be transparent about and share uh, with everyone viewing this, is that my kidney damage came about from over the counter drugs. They're called, there's a term, they call it NSAIDs. That's what it's called. Hold on one sec. Let me see. I'll spell it out. I'll spell it out for you all. Let's see. Um, this is exactly what this is. This is exactly what this is. NSAIDs. I'll put it on the screen. NSAIDs, aka painkillers. What do I mean by that? Or what does that mean? NSAIDs are painkillers, and painkillers could be as what you think is harmful, aspirin. Let that sink in. Aspirin. An excessive use of aspirin could cause damage to your kidneys. Over the counter cold medicine. When you go in CVS, Walgreens, cold medicine could cause damage to your kidneys. It's very important when that pharmacist asks you, do you have any questions? The one question I would ask to that pharmacist is, does this medicine or medication filter through my kidneys? That's a question. Does this medication or does this cold medicine, because like now we get ready to come up, we're coming up on a spring, and a lot of us have sinus issues. I know here in Atlanta and Georgia it's really, really bad. The pollen, and we want something to ease the symptoms so you could just breathe, right? You feel horrible, you don't have a fever, it's not a cold, it's a sinus thing. So you just I need to go to Walgreens, get me a little something, or CVS, get me something. uh I got to go to work, or I got things coming up, I got stuff to do, right? And now if you pop in this stuff all the time, you need to go to the pharmacy, say, hey, does this particular thing filter through my kidneys? Be careful, be mindful of that. Because there's certain medication, and we talked about aspirin, which is filtered, or painkillers of Advil, ibuprofen, those things are NSAIDs. They are filtered through your kidneys, and they could cause damage for obsessive use of it, right? Now, there are other medications like Tylenol, that's filtered through your liver. And during the course of my kidney journey, learning more about my disease, being educated on it, I learned and discovered that your liver is the only organ that can repair itself, right? So, as a kidney patient and a dialysis patient, Yeah, I had a few surgeries. I had to get access. I had to do this. I even had a nephrectomy, which is they had to remove my right kidney. That's a whole nother story. But anyway, and of course I needed something for the pain. But they knew to give me those pain management medications that was filtered through my liver, because I pretty much have a healthy liver. I'm pretty much a healthy guy, but just dealing with kidney disease. And when I was younger, my eating was poor, my diet was poor, my job at the time was very stressful. I was up late at night, eating a lot of grease, a lot of fast food stuff, and I would suffer with headaches. And I had high blood pressure, did not know it at the time. And so I used to take these things they call BC powders. I used to pop them like, you know, they were Skittles or something, or M&Ms. Even if I thought I was gonna get a headache, the headache wasn't there yet. But if I said, "Hey, every time before I leave work, I know I'm gonna get a headache driving home. So let me just be proactive and pop one of these BC powders." That's what caused the damage to my kidneys. That's what caused the damage to my kidneys. The blood vessels, along with the high blood pressure, caused damage to my kidneys. CKD, specifically FSGS, that's a whole nother story, or session. So, yeah, get tested, my people. Get tested, please. Get tested. Talk to your doctor. What am I doing here? I'm wilding out. Please talk to your doctor about ways to prevent CKD. All right. That's very, very important. I hope that was helpful. And again, folks, thank you so much. And please take a moment to complete our quiz and evaluation form. This is for the kidney, the American Kidney Fund. As a kidney health coach, we'd like to be evaluated whenever we are um, providing education to individuals. Uh, any type of feedback that you can provide, let us know if we're doing a great job. Let us know if you learned anything. That is very, very helpful. Any suggestions on anything else? So, hey, I appreciate all of you joining me during this time. Again, every Tuesday of this month, the month of March, which is National Kidney Month, the Get in Position Foundation, along with the Kidney Corner podcast, we will be providing educational sessions. I hope you guys learned something. Also, to reach out to us at info@getinposition21.org. Send us an email. Uh, just reach out to us, connect with us. And that's it, folks. Thank you so much for joining. It is recording. You can always go back. Please share this link again with a loved one or anyone who you know who is dealing with chronic kidney disease. Please let us know or share this information with them. We greatly appreciate it. And hey, make sure you get in position as it relates to your health. And we'll see you guys soon. All right. Thanks for joining us. Peace.